Hey everyone, Shannon here with Therapy by Shannon, professional counselor in Louisville, Kentucky. Thanks for joining us for our Ask Anything series where we take questions asked by you guys and we get them answered by professionals in the field. We have a mental health counselor here with us today. To answer your question, we're going to be talking with licensed clinical social worker Chauweda Smith. She's in private practice with Total Life Counseling. She's located in Louisville, Kentucky. She provides individual counseling with children, adolescents, adults, and she specializes in working with individuals struggling with trauma. She sees clients in the office and also provides teletherapy services. And you can learn more about her and her agency at her website. It's tlcoflouisville.com. But thanks for being with us here today to answer our question. The question today is going to be, when I'm looking for a therapist, what should I be looking for?
Okay, so when you want to interview your therapist to see if they have like similar, well, like similar things that kind of like your moral, um, if they're able to work with your particular issues. For
Mm-hmm.
example, if you're suffering with anxiety, you want to make sure that they have experience working with people with that issue.
Yeah.
So do a little background research on
Yeah.
your therapy.
Yeah. Where would you recommend? I mean, of course, like, so for example, like on your site, do you have a lot of that stuff listed on your website so people can kind of like go and get some of those questions answered before maybe a consultation call? Or how do you recommend people do that?
Yeah, so on the website, it's listed all the specialties, areas of expertise that I have as far as the population that I work with, children, adolescents, and adults. So you can pretty much get all of that information on the website
Mm-hmm.
and for a 15-minute consultation too, as well.
Yeah. And do you have any kind of, I guess, sample questions that prospective clients typically ask you during those consultation calls for that little bit of an interview and getting to know you?
Yes, they can ask me what population I normally work with, how long I've been working with this population, um, and also if they want to see if the therapist has any biases towards any kind of groups. Usually, I don't know a therapist that does, but you want to make sure that that therapist is comfortable working with a certain population.
Mm-hmm. Yeah. Yeah, definitely. And I think like normalizing that, I feel like during the consultation call, clients or prospective clients may feel that it's the therapist that should be asking all the questions, but to normalize that, like prospective clients should be asking therapist questions because it's kind of their service and their autonomy to pick their provider, and of course
Yeah,
want them to be comfortable with who they.
going to be a good working relationship.
Mm-hmm. Yeah. Yeah. What are some other things, kind of other than, of course, wanting to make sure they, well, I guess specializing in what you're struggling with, what if the client has a really hard time, kind of like articulating what they're struggling with? What would you recommend to that prospective client who maybe, whose partner is really pushing them to go into services, or maybe their guardians are really pushing them to go into services? They may not really want services.
Right.
How would you, yeah, I guess, how would you navigate that?
I I would ask them what they can personally see what how therapy will benefit them, regardless of who wants them to come to therapy. What can they see themselves that they need to work on?
Mm-hmm. Yeah. And sometimes at the beginning, it's like, well, to get my parents off my back, I'll come to these sessions. And maybe that'll evolve over time in that relationship with your therapist.
Right.
Yeah. Well, is there
And
anything? Oh, sorry.
a lot of times people really don't know what to say until they get into the first session.
Mm-hmm.
So once they come into the first session, the assessment, that's when we really can get into the reasons why they want therapy.
Yeah. Yeah. And that's a good point too, that the kind of interviewing and being able to make sure that you're collaboratively kind of matching with the therapist you chose doesn't end after the consultation call. You can kind of use those first couple sessions to evaluate that. And then as the client, being able to pick and choose, you know, if that's the right therapist for you or not.
Right. It can take several sessions for that.
Yeah, definitely. Is there anything else kind of in looking for a therapist that you, I don't know, any tips or recommendations or anything else that you would suggest people kind of be on the lookout for?
Well, you want to make sure that they have availability. A lot of times people sign up for therapy, and the therapist really, you know, they may not have the availability that you need. If you're looking for weekly sessions, you want to make sure your therapist can offer that.
Yeah. 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 Another thing that I just thought of kind of with availability is like form of payment. So like whether you're going to do insurance or private pay or sliding scale, like making sure that's a question too, because obviously it's a big financial commitment.
Yes.
Yeah. Okay.
Making work, you know, because you don't want any surprises on the first day. You know, the insurance isn't active. Yeah, checking those things before you get into the first session.
Mm-hmm. Yeah. Yeah. Okay. Now I'm trying to brainstorm anything else. I'm trying to think like, what do my clients typically ask me? Let's see. Yeah. I don't know. What else should people be looking for in therapists, or have we kind of covered it all?
Really, the main thing is specialization.
Mm-hmm.
When that want couples therapy, for example, I do not specialize in couples therapy. I'm marriage counseling, so I really refer them out to someone who does.
Yeah. Yeah. And it's the same kind of with a lot of like, you wouldn't go get heart surgery by a dentist. And so you want to find,
Exactly.
same in the mental health field, find someone who specializes in what you do. And just because, you know, you work with children and adolescents doesn't mean you work with every child and every adolescent. And so even being able to know that, like, obviously everyone is unique in what they're bringing into therapy, and you have your specialty within that population of children and adolescents or whatever it may be.
Also, I'm thinking about the different therapy techniques you may offer, EMDR for trauma, whether or not you take a holistic approach,
Mm-hmm.
that too.
Yeah. Yeah. And I have kind of talked with some friends and family before of like seeing lots of lingo and terms on therapist sites and not always knowing what it is. So of course, yeah, like when you're looking for a therapist and you see EMDR on their site and don't know what that is, that's a great question to ask them. Like, I don't know what this is. I Googled it, still kind of confused. What is it? And then that therapist can kind of inform you in on it.
Right.
Yeah.
They just are really important too.
Mm-hmm.
Some people prefer Christian therapists, or and want to know if your therapist is aligned with that. You know.
Yep. Yeah. Yeah. I'd kind of say like, as a prospective client talking to your therapist, there's not a lot of topics that are like off the table. So if you're curious, have a question, ask it.
Right.
Yeah.
Exactly. You want to know pretty much if you're going to be a good fit for the most part before you have that first session.
Mm-hmm. Yeah, definitely. Well, cool. Any kind of mental health tips, tricks, anything you want to leave the audience with before logging off?
Well, with everything going on with current political climate, people are just so busy with that and protesting, and then on top of kids being in school, NTI, and having to work, and it's just a lot going on, and everyone's anxiety seems to be up.
Mm-hmm.
I would say, especially practice self-care, be mindful of things that you need to do right in front of you.
Yeah.
Start thinking about too many things at once. That's when you get really overwhelmed.
Yeah, trying to focus on like the here and now, or literally like what's coming in 10 minutes, not 10 days.
Exactly.
Yeah. Oh, well, thank you. And thank you so much for answering that question. Guys, remember that you can get in touch with her on her site, tlcoflouisville.com. And if you guys have a question for us that you want us to get answered by a mental health or wellness professional, just go ahead and DM us the question and we will get it answered for you. But until, yeah, not a problem. Until next time, enjoy and be safe, and yeah, have a good day.
You too.